next speaker of the day, Dr. Liaqat, Clinical Director, Physiotherapist, on topic scope of physiotherapy around the world. He will be joining us virtually from Canada.
My name is Liaqat, and I'm a physiotherapist here in Canada. I would like to introduce myself from the very beginning. So I was a classmate with Dr. Asif Gulzar Sheikh in 1998 in Jinnah College of Physical Therapy in Karachi. And from there, we graduated together, I and Asif Gulzar Sheikh, and then we struggled with our jobs at different places there at Karachi. And then we moved together to Islamabad and then to Pakistan Cricket Board. So that was my career in Pakistan. And from Pakistan, then I went to study in Sweden. So I got an admission in sports medicine and master in sports medicine. That was the time when I moved from Pakistan to Sweden, and that was a completely different experience for me. So when I got to Sweden, I would like to share that time within Sweden, that how different it was from Pakistan. In Sweden, everything was completely different. Everything was westernized, and that Western culture was completely different for me. Being a student there in one of the universities in Lund. So I would like to share all these things so that my students here, they know how it is different from Pakistan and how it is so hard in these Western countries for us to survive and then to go ahead within our field. So in Sweden, my degree was basically a research-based degree, and back home there in Pakistan, we were not familiarized with the research. So one of the things that I would like to emphasize more on the career being a physiotherapist is to focus our studies like obviously for Pakistan, but our vision should be for abroad. Like we should focus more on the research more than like memorization of the things that we used to read it in Pakistan, right? So we would memorize the things more than we would understand the things. And that is the basic difference between education in Pakistan and education abroad. So here in these countries, they focus more on the subject. They understand the subject very well, and after that, they go into the field. So this is what I would like to recommend you guys as students, as my friends, that when you guys are studying, like I can see Dr. Rana Siddiqui, assalamu alaikum, madam. When we started in Karachi, she was our teacher, the best teacher, I would say. And we learned many things from her. But unfortunately, like the things we used to hear from her, we never paid attention to them in practical life. Like we just used to memorize the things. And we would just focus on the exam to just get some marks and get through the process, right? But now I realize that if we were able to understand what Dr. Rana Siddiqui, our beloved teacher, taught us, it would be very easy for us to go into this Western culture and be like at the same level at their education. So I was telling you the story of Sweden. Then from Sweden, I got back to Pakistan, and after a few days, I came here to Canada. When I came here, it was a very tough time for me because I had to survive. I had my family, and I had to study together for like at the same time for the exam. So here, the process of licensing is a bit difficult from like Pakistan. In Pakistan, fortunately, we don't need any license. We just get our degree and then we go straight into the field. But here, the first thing that I would like to share is how people get into the field of physiotherapy here in Canada. It's a very, very long process and very difficult. I asked many students who are studying here for their career being a physiotherapist. In Pakistan, like we are the most luckiest students that they get into the field like after passing the grade 12, and then go through the 4 years, or what I believe 4.5 years, right? And then we become physiotherapists. But here in Canada, it's very, very difficult. They need graduation first. After the graduation, like during your graduation, you need to have 4 GPA, which is for us, like people from Pakistan like me, very hard to get 4 GPA score and then get into a master's degree in physiotherapy. Even when you complete your degree, you still have to go through this exam, which is composed of 2 parts. One is the written, the other is the clinical. So once you get your written pass, then you have to work, depends on which province you are. Like for me, I was in Alberta, and I was allowed to work for 2 years to just get ready for the clinical exam. But in Ontario, where you are allowed to work only for 6 months, and then you have to attempt your clinical, and if you are successful in 3 attempts, you get your license, or if you fail the exam 3 times, you can never get that license. So by telling all these things is, I mean to say that if we can study according to the curriculum here, there is no difference between physiology, anatomy, and biomechanics and anything. The difference between this system and that system is that in Pakistan, we study keeping the exam in Pakistan in our mind. Here, they study in going into the field and working as a physiotherapist. So I would like to tell you something about the exam as well, that in written exam, all the basic things that we study at our bachelor level, they are being tested. So if you know your anatomy well, you will be able to attempt the questions from anatomy. If you know your biomechanics well, you will be able to understand. So the first thing is understanding the question and then answering that, right? So if you have this knowledge from the bachelors, you will be able to pass the exam very easily. Many people come prepared, and these days it's very easy for students in Pakistan that they can prepare very well. Being in Pakistan, they get their credentials done, and then they can attempt their exam online from Pakistan as well. And I would offer my services, like being a colleague, being a friend of Dr. Asif, that if there is anything I can do to prepare my students for the exam, I am always there. Just a text away. So after that, when you get into the field, there are 2 things that people do in the field. One is going on the clinical side. The other is going on the research side. Like myself, I never paid attention to the research side because I was looking for some clinical things that I do and just make money and just have a good life. That's easier than being into the research. I was working in a clinic. We had both departments. One was clinical, one was the research. We used to do lots of, not us, but the other team, they would use to do lots of the research, and then they will present their research, and then we would implement those researches into our clinics. So that is one thing that I would recommend you guys to get familiarized with the research as well. I'll go back to Sweden degree. When I went there, everything was research-based. And from Pakistan, I did not know what and how to do a research, right? Like how to do the systematic reviews, how to do the critical analysis, and how to implement these things in the practical life. But with you guys, there is a very good opportunity. You have lots of good teachers around you. Just study according to this era. Like we started back in 1998, but now it's 2023. You have lots of resources, you have lots of good teachers, and you have the opportunity right now to prepare yourself not only for Pakistan, but for the whole world. UK is there for you, Canada is there, US is there. Anywhere you guys want to go, you can go. So I was telling you about the clinical and the research thing. So myself, I work more on the clinical side. So when you guys get into the field, there is no difference between a white or a black or a brown person from Pakistan, from India, from US. All are the same. Even I would like to share an experience which I did in one of the clinics. There was a guy, and he was a retired engineer, but after retirement, people do some odd jobs to survive, right? And he was working on cash counter, so he would be standing for long times. And he had one problem with one of his knees, that it would not straighten completely. He did his MRIs done, his ultrasounds, all the investigations were done. They couldn't find anything. When I did some proper assessment, I found out that a small muscle that all of you know, a popliteus, which initiates the first degrees of flexion in the knee, right? That muscle was very, very in a good spasm, like it was hard enough to be stretched. So I worked on that guy, and we did some manual therapy. I used some technique, which we call the Graston technique, or instrument assisted soft tissue mobilization. And believe me, that guy got fixed in 3 sessions. So by telling this, I just want to let you guys know that when you guys enter this field after passing your exams and studying well, there is no difference between these guys and us, that we can perform better than them. And um, I believe that when you guys pass your exams, there will be no problem for you to do any kind of clinical or written exams here in the Western world. So this is what I would like to recommend again and again to you guys, that just do study whatever is available for you, like the modern researches, the books that you guys have are very, very up to date. And the teachers you have, they know much, like they are not, like, no, I would not say illiterate, but they are not substandard, right? They're all very good teachers around you. And if there is anything you guys need any help with, I will always be there to offer my services. And there are many agents around us as well. If you guys need any help from the agent, those who apply for the students or offer their services as well. Is there any question for me, guys? Assalamu alaikum, madam. How are you?
I'm very well, thank you. Pleasure to see you here. Um,
Yeah, it's so nice to see you there.
yeah, same here. So actually, it's not a question, it's just a comment. It's just a comment
Okay.
that what you just said, that our academia, our students are very strong in academically, and being a PNE teacher, like I've been the examiner in the part 2 practical exam, what I see our people lacking is the approach, the way they approach the patient.
Exactly.
That's interpersonal communication. How do you go to the patient? So if you ask them about theory and all, they're great. So probably something, what you were offering is awesome. Something on those lines also, we can maybe together do something for our own people, our own kids over here.
Of course. Of
So
course.
that was my observation that I always had as an examiner. Okay, they do good, but what happens when it comes to practical? Why do they fail? You know the failure rate within South Asian
Yeah.
community, second, third attempt, sometimes they never make it. And that's
That's
what
right.
that's what I see. So that was the only comment I wanted to make. Thank you
Thank you
so
very
much.
much, Dr.
Thank you so
Taiba.
much.
Yeah, I actually had that point in my mind, but then that skipped out of my mind. So as Dr. Rana said, that the approach that we guys have towards the patient, that's completely different from Pakistan. That the way we deal with the patient and the way these guys deal with the patient. Like a very small example is that when we approach the patient in Pakistan, we never take their consent. That, would you allow me to examine you? Is it okay if I touch you? Are you comfortable? Um, would you like me to teach you some exercises? We never learn these things in Pakistan, and as Dr. Rana highlighted these things. So this is the basic difference that we guys have from these. Their approach has been like one of the students. She told me that during their studying, like during their 2 years master, they keep practicing these exams repetitively. And if they don't do the exams during their studies, they cannot promote to the next semester. So that's how they are taught that this is the way you will enter into the field, which we guys lack. So again, I'll say the same thing. If there's anybody interested in learning about the exams or the procedures in Canada, just approach Dr. Asif Gulzar, and I will be very happy to do my best to guide you guys, like especially those who are in their final year, or those who are just preparing for the exam, and those who are entering into the field very soon. I would like, and I will be very happy if I can help those people prepare for the exam. And what I would recommend, Dr. Asif, as well, that when our students, like the final year or the fourth year or the third year, when they enter into their clinical, I would like to sit with Dr. Asif one day, hopefully very soon in Pakistan, inshallah, and make some strategies for our students to make them ready, at least to know the system and how the way we here in Canada treat the patients and we perform our things here in Canada. So very soon, inshallah, we will develop some strategies for the team and for the students. And again, if there is any question among the students for me, we still have some time to answer.
Assalamu alaikum, sir. My name is Dr.
Walaikum assalam.
My name is Dr. Karamullah Mehman, and I am working 5 years over Pakistan. I just need to ask you one thing. Is
Yes.
there necessary to go foreign for a good practice? Can't we do good practice in Pakistan?
That's a great question. Okay. We definitely can do good practice in Pakistan, and that is what I would like to recommend, and I highly appreciate your question. The only thing that people from Pakistan, like myself, we do is just in search of a good future, which the current situation of Pakistan, you know that things are not very well balanced, right? Like the inflation is high, the job opportunities are very low, the salaries are very low. So, inshallah, if you have kids or when you have kids, inshallah, so then it's one point you will be concerned more about your kids, which like in my case I was, and most of the people I know around me are. So at some point you will think that, okay, let's try going abroad, like for example, UK, Canada, US, and give a better future to our kids than ourselves. So that is why people try to go from Pakistan in search of a good future for their kids or themselves. One of the irony in Pakistan is like the standards we guys, our physiotherapist community, we have decreased the value of our field. It's not the fault of any other, like neither the doctors nor the community. We do not give respect to our own field, and that is a bit unlucky for all of us. If we start thinking about not ourselves, but the whole community, the whole physiotherapy community, hopefully the standard of our practice will go higher and higher very soon. Like personally, now at this point, I have been talking to Dr. Asif, as he is a best friend of mine, that I would like to move back to Pakistan now, after all these years and all these struggles. And that is maybe because you asked me this question, I'm telling you the answer that if we can develop a good practice in Pakistan, nobody will need to leave the country. We all can perform better inside our country than abroad. But what I said, or what I meant to say to my students was that if you guys are planning to go abroad, So you can perform better than anybody here in Canada, like in any country. Doesn't matter if someone is white or if someone is speaking better English, but we can make ourselves as high as these people are. So I I will pray for you that you have a very good future in Pakistan. Inshallah, you will have, and may Allah give you a higher rank in Pakistan, and then hopefully we will come and practice with you under your supervision as well one day.
Thank you, sir. Thank you so much.
Inshallah.
Assalamu alaikum, sir.
Walaikum assalam.
Sir, my question is that how we apply to the abroad at very easiest and finest way. Because in Pakistan we are no any sources that we are easily approach them. It's very difficult to go to abroad and prove ourselves as Pakistani.
The first part of your question, I will agree that it's very difficult for us to go abroad from Pakistan. So it depends on where do you want to go, right? Many people from Pakistan, from our college, from Jinnah, many people are working in UK, many people are working in the US, lots of people are working in Arab countries, many people I know from JPMC are working in Canada. So the first thing that we need to do is to find like a strategy where to go, right? So when you decide where to go, then you have to go onto the standard of the requirements of that country. For example, the exam in Australia is different from Pakistan. They have only one exam, which covers their clinical and their written. US has one exam. Unfortunately, Canada has two exams. UK might have two exams as well. So you will have to make up your mind where exactly do you want to go. And then you will have to do a research on their system, like the requirements. For us, one of the requirements which is very difficult is to get 7 bands in the IELTS, which is not very easy for us being Pakistani or being like, I belong to Swat, and in Swat we never speak English, right? We live in the mountains. We hardly learn Urdu. So getting the level of English according to the requirements is the first thing that we need to do. The second thing I will repeat is the way we study in Pakistan and the way these guys test the students is completely different. In Pakistan, we do rata. We memorize the things by heart. We never understand what these things are. Here in these countries, they barely know the things by heart. Whenever they have any problem, they just go back to the researches to study and then discuss with someone, and then after that make a plan. If you have an intention to go abroad, you will have to study according to their requirements. Once you fulfill the requirements, then you are all good. The second thing that you said was about Pakistanis. So there are countries where there is some racism, but there are countries where you will not see racism. Like Canada, I will say the example is Canada. In Canada, when you enter, then you are a Canadian. There is no difference between a Canadian citizen and a Pakistani immigrant. Everybody is equal. I cannot say about other countries because I did not travel a lot other than Sweden. In Sweden, I didn't see anything like that either. And I was the same student as the Swede or someone from another country, and myself, we would be the same. So there is no difference between the status of immigrant and the other thing, but there definitely is a difference between the academics back home and here. So if you study according to wherever you want to plan to go, hopefully you will not be disappointed.
Is
there anybody else who have any questions? Kindly feel free to ask.
I have a comment here again. Hi, Liaqat. It's again a comment, and it's not directly a question to you. So I really compliment the gentleman who raised this question. I have a strong belief in our youth. You guys can go even far and beyond. Nothing can stop you. You just need the right directions.
Hi Liaqat, this is Sunil here. How are you? Sunil, just correction perhaps because I have practiced in the UK. So in UK there is no exam, so you should all be happy. There is no exam. Yeah, there is no exam in the UK. You do have to present your case. There are about 50 or 60 pages that you have to fill, show your clinical accreditation, your experience, your knowledge. It's quite aggressive, but there is no exam in writing, or there is no viva, or there is no oral exam. It's just presenting a case, so we should be happy. And I'll talk more about UK as well. So thank you, Liaqat, for sharing us.